Hey everyone, Diego Reyes, functional health coach, functional nutritionist, owner of Complete Vitality, functional health coaching organization. And today I'm going to have an honest, heartfelt conversation with Dr. Luke Weber. He is located here at Kinetic Spinal, here located in Mankato, Minnesota and surrounding areas. This is going to be a great insight video, just speaking on kind of what Luke does inside of his practice, and really taking that holistic approach with helping individuals really with their movement, pain, and all other things. So with that kind of being said, Luke, I kind of want to talk about, just an honest conversation, really nothing too crazy. But what we really want to get into first, Luke, is like, what kind of led you into, have chiropractic care and everything?
Yeah, I think my journey into chiro care is similar to a good amount of people where we really just wanted to be in a patient care world. So when I got into school, I was either going to go the chiropractic route or I was going to go the nursing route.
Okay.
Those to me were both professions that get to spend a good amount of time with patients, be hands-on with their care, and be like heavily interactive. And to me, it just fit who I was personally and skill-wise. And so I went down that route, and then eventually decided, okay, let's commit to this chiropractic route, and kind of see where it goes.
Yeah.
So some of it was just based off of having that initial interest, and then over time, I would honestly say chiropractic or chiropractic care is way bigger than I initially thought it was, which is part of what keeps it interesting and fascinating for me.
Yeah, absolutely. And I guess, like, where did you kind of learn, I guess, what school did you graduate from, and for the listeners that are interested, perhaps?
Sure. So I did my undergrad at St. Cloud State. I went up there because
Located in Minnesota?
Yeah,
Minnesota.
St. Cloud State,
We
Minnesota.
get people worldwide watching this.
Northern Minnesota. So I went from southern Minnesota to northern Minnesota.
Yep.
Not ideal weather-wise, but that's just, what we have around here.
Yep.
So I went there for my biomed degree, which is basically like a general pre-med degree.
Yep.
And I was on the swim team. So that was kind
Oh,
of
really? You did swim?
diving specifically.
Okay.
But
There you go.
On the swim team. Yeah. So that's what got me to that location, and then once I graduated, I went to Iowa for chiropractic school.
Okay. Awesome. Iowa. How was that? Was that 3 years then for the
4?
It was 4.
Yep.
So in school for a total of 8 years, or was
Yes.
it more with that with like the clinicals and stuff?
So the clinicals are built into our chiropractic program.
Okay.
So it's kind of like the first half of it is mostly academics, and then the second half is mostly hands-on.
Okay, awesome.
So that was at Palmer College, yeah.
Yeah, well, I love, one of the most fascinating things that when I came here initially a few weeks back to talk to Luke, is that when you hear the word chiropractic, you hear the word like, oh, it sounds like adjustments. Like you're on the table, you're getting either, back movement adjusted, which is incredible. But I love that you said you hone in on like specialty for like the movement prevention, like some type of rehab to fully like resolve the issue, because I think that's very needed, because adjustments are incredible, but I think I love the fact that you're saying that, like, hey, let's actually like focus on getting this muscle corrected, getting this injury to be improved from there. So can you kind of dive into that, or basically kind of what's your methodologies and stuff inside your clinic, because we're inside his clinic, so the way he does things is different than maybe other chiropractors, and that's crucial, because it's like when you're looking to find like, hey, which might be a chiropractor I want to see. Well, it's not the same. Everyone's not the same. Just like if you're looking for like another coach or anything like that, everyone has their own ways. So like, can you kind of explain yours?
Sure. Yeah, I would say that's one of the things that, especially in the chiropractic world, where it's probably more similar to the coaching world than it is other medical professions, where chiropractic is a very young profession. I think so. It was invented in Iowa, where I went to school.
Oh, wow.
Yep, which is random Iowa history facts.
Iowa.
Yep, and it was invented by Dr. Palmer, so hence Palmer College of Chiropractic.
Okay.
So that's the first chiropractic school in the world, although there were other places around the world doing similar things, like joint manipulation-wise.
Oh, okay.
Yeah, so that's where it started. but it's only, I think, 130-year-old profession. So when you look at the huge world of medicine, how long has medicine been around?
I mean, hundreds of years it has to be.
Forever, right? And so because it's so young, it's not a super standardized profession because it takes time to, learn and do research and then recalibrate how you practice. Do more research and recalibrate. So because it's such a young profession, it really opens up the playing field for how people want to practice. So it lets people be very unique. You can really
Like
fit
innovative,
and fit into a niche. And I would say there's pros and cons to that because there's a lot of chiropractors that take that to some extremes that it might not really make sense. But because it's not standardized, it's doable.
Yeah.
Versus like the easiest comparison is like physical therapy. Physical therapy has been around much longer. So when people go to a physical therapist, they probably have a much better idea what's going to go on before they even go there.
Wow, yeah.
Where chiropractors, it's still very different. So when it comes to our approach, we kind of take the chiropractic route where we're going to do some adjusting, some mobilizing, manipulation, kind of whatever you want to call it.
Yeah.
And then we're going to mix it with a lot of the PT world where we're going to talk about exercise, physical activity, stretching, mobility, other stuff like that. And then I would say the third layer, and this is probably the most important one, is just education.
Yeah.
Most people in general have a pretty low level of self-awareness in terms of health unless something goes wrong. That's really, in the culture that we live in, that's the only time that people tend to do more investigating and maybe some internal search.
Yeah. And I think that's where you and I get really along because we look at the Western conventional medicine, what people are doing, and they're reactive. Yeah. People are reactive. They get a lab value. It's like, oh, you're in pre-diabetes range. Now you're reactive to where you could have been. And so exactly what you're saying, it's like empowering, educating the individual to understand like, hey, I'm coming in, doc, and it's like I got a lot of neck pain, and obviously I don't want to go get surgery or anything like that. And it's like, hey, well, let's do these things so we don't have to keep dealing with this nagging issue. Let's actually fix the root cause of the issue. Yep. And I love that you talked about too that it sounds like it's a free-for-all when you're graduating from chiropractic school and you have your own practice. And I completely agree with that because there's so many people because I've been doing this for a little bit too, just like you. You've been doing this for what, 8 years in totality, right?
Almost 9. Yep.
Yeah, basically a decade. And so like you see a bunch of things. And what I've seen too is people come to me and it's like different chiropractors doing obviously different things. They're doing muscle testing. They're doing, let's say, like dry needling. They're doing Graston. They're doing all these techniques, which are all incredible. And then there's some that are doing like different types of like sound healing. They're doing, a lot of like healing, Ayurvedic medicine type things. So I think a good thing what you do is like you kind of figure out like where the individual needs, like what does this person need? Because what I see as a mistake is that a lot of it's not bio-individualized. And just like you referenced, you said as what you're doing, which is incredible, and what I do is like coach. You're a coach. You're not just some physician provider that it's like, hey, this person's dealing with this issue, so I'm going to give them this medication, I'm going to do this treatment. No, it's where the individual's at. And I think that's crucial where you come because like that allows anyone that comes through these doors to just be like, wow, I'm going to get a very personalized, personable approach to be like, hey, they're going to meet me where I'm at. Not only that, but you're going to be able to help them with preventing whatever is going on from, in the future. But I guess with that kind of being said too, like, I guess like, what is your thoughts on like people that come in and they're like, hey, they're wanting me to do these surgeries and things like that. Are you trying to come up with more preventative things at first before diving straight into that, or?
Sure. So it all depends. And I was going to kind of make a comment on that too, where there's parts of Western medicine that are fantastic. Yeah. And that we need.
Exactly.
And so when somebody comes in and let's say they're afraid of having a surgery, I'm going to ask them, well, what has your history of treatment been like? Because if they come in and say, well, I had this accident happen 5 years ago.
Yep.
I've done PT for 2 years. I've worked with another chiropractor for a year. I've done some other acupuncture or pain management stuff. I've done injections. If they've gone through, what I think is a good timeline of just good attempted treatment and they're not responding, maybe surgery is the right thing for them.
Yeah, absolutely.
And I've seen cases where somebody's kind of ran through the gauntlet, is what they call it.
Yep.
And they get to the end and they're having this conversation about surgery, and I might lean that way and say, hey, it sounds like if your body was gonna adapt and recover the way that we wanted to, it would have by now.
Exactly.
So maybe surgery's the thing, and that's okay. And so when we get to that place in the conversation, we're shifting our approach from preventing a surgery to how can we maximize the outcome of this surgery?
Yep, exactly.
Because if we think this is the right thing, let's prepare you for that. Let's get you conditioned. Let's build up all the other things. Because after that surgery, you're still going to have to recover.
Yeah, and strengthen all other assisting muscle groups as well.
Correct. Or just their body in general.
Yeah.
For people that go into a surgery, if they're struggling with their weight, if they're struggling with other stuff, they're probably going to have a harder recovery process than if they were at a healthier weight doing healthier things.
Yeah.
So it really comes down to double downing on their overall health to get the most out of it.
Yeah, absolutely. Well, I think that's pretty crucial too, because it's like if you exhausted all other options, that's why Western conventional medicine could be very beneficial. And I mean, same here. I mean, at the end of the day, I think a lot of people sometimes in my space will completely bash Westernized medicine, allopathic, conventional medicine, which is kind of faulty. And matter of fact, I really do have a telehealth medical clinic with me.
Right.
So I have doctors, I have physicians that work alongside me synergistically with uncovering the root cause, but more importantly, using, let's say, pharmaceutical drugs to be able to help the individual get to where they need to be. Is that a long-term solution? I mean, it depends on the individual, obviously. It sometimes can be a periodized thing where it's like at this point, let's focus on doing this while, let's say, we're taking this type of thing for that, then it could be very beneficial. And then the main thing is that, yes, the acute care is absolutely 100% the top tier for Western conventional medicine. That means like I got into a car accident, I got pretty much like essentially shot, like any type of acute care like that, like surgery. Like, obviously, that's where Western conventional medicine shines. What I think you and I see, though, is that when someone's dealing with a chronic condition, meaning it's like it's lasting months on end, that's kind of where they sometimes will lack at times. Where like someone comes in and it's like, hey, doc, like, man, like my back is just, I'm not feeling like that. And so they're telling their primary care physician or whatever. And they're referring you out or something, and then they're referring you out to someone that would maybe do surgery without even trying other therapeutic ways to help with that. And I think that's kind of where things can go wrong. Because like, for example, for me, people are taking, let's say, like thyroid medication, or they're taking, let's say, blood sugar medication, which will be very helpful. But if you're not kind of focusing on like what else are you doing to help with preventing this issue, supporting this issue, then it's like, yeah, you're kind of just masking the symptom. So it's like if someone's just focusing on like, hey, I got this surgery done, but it's like they're not correcting how they're moving every day, their posture whatsoever, it's like, well, I'm still going to deal with issues. And I'm sure you might have seen that where it's like, hey, I have this surgery, but it's like I'm still dealing with like hip pain. Like I had a spinal surgery, I still got hip pain. And it's because at the end of the day, they didn't fix their lifestyle, their movement, and they didn't, focus on maybe like getting stronger joints, muscle groups to be able to stabilize themselves. So I guess kind of with that being said, do you see a lot of like people coming in that have had surgery and they're still dealing with issues?
Yeah, for sure. I can't remember the exact terminology for it, but there's literally a condition called like failed spinal surgery something. I can't remember the exact term. But it's basically like a term that they put for people that have gone through all the steps. They have the spinal surgery, and then they're still, in the same place. And that's tough. Like those are some really, really hard situations to work with people. So to answer the question, like that's it. And I think what's hard with that is the amount of education that people get leading into these procedures doesn't always match the clarity that they probably need.
Yep.
Because what I see from a lot of people is they have this idea that the surgery is going to be the solution, and then when they get to the other side and it's not, they're like devastated. When in reality, like all of these procedures have a success rate,
Yep.
which means they also have a failure rate.
Yep.
And if people aren't properly educated on that, not only is they're just going to get blindsided by that failure. And from the mental, emotional, psychological perspective, like that is so hard for people to work through. Because if they feel like, hey, this was supposed to be my solution, and now I'm still in the place where I was before, not to mention that surgeries are hard to recover from. They're not cheap. They take time.
Exactly.
It just creates a much harder environment for people than I think they deserve to be in. And that's really the part when I'm having these conversations with people that are thinking about leading into a surgery. I make sure that they at least understand like what they're signing up for and what it's going to be like. Because one of the best ways to make something harder for someone is to not prepare them for what's going to happen.
Yeah, absolutely.
Vice versa. If I know somebody's going into a surgery, whether it's a shoulder repair, a knee repair, a hip repair, I'm not going to tell them, yep, you're going to go in for this surgery and in like 2 weeks you're going to feel great. Because chances are you're not.
Yeah.
Sometimes you're actually going to feel worse.
Exactly.
But it's a lot easier to handle that worse situation when you know that it's coming, when you know that it's a part of the process, and that if you work through it appropriately, you're going to get to a better spot. So it's helping them frame it in a way that's actually helpful for them instead of not.
Yeah, exactly. I mean, it's obviously like the saying, you got to take, one step back to go 2 steps forward, before the true transformation can happen, before you're feeling your absolute best, you're going to be going through a probably harder time. And that might be the rehab of the surgery. That might be the preparation up to the surgery. And I think that's pretty vital to understand. And so I guess with that also being said, like, what are some of the common things you see kind of in your practice that are very preventative things that people deal with? So like if let's say, everyone comes in, they're like, oh man, I got to get my neck adjusted, I got to get my back adjusted, because surface level, they're like, oh, it's a chiropractor. But then they come in now and you're actually educating them. Maybe you will do the adjustments and then you're educating them too, like, hey, these are the things that are causing that. And all that. Like, so what are, I guess, like first, like the common things people come in for, and then how are like their preventative things to be able to improve that?
Sure. So in the pain management world, we always have to be careful with when we use the word preventative.
Yep.
Because, we could take you, for example. You train at the gym pretty hard.
Exactly.
You take care of your nutrition. You prioritize a lot of these health things, right? That I would say puts you in good shape, puts you in a good condition, makes it so that your body's highly adaptive.
Yep.
If you walk across the parking lot and get hit by a car, guess what? It's still going to hurt.
Exactly.
So we can't just simply prevent pain by doing all the healthy things because life happens.
Exactly.
But what our goal is with that is when life happens, we want the things that cause pain to be appropriate. Getting hit by a car should cause pain. That's appropriate.
Yep.
Getting up in the morning and putting on your socks should not cause pain.
Exactly.
And I would, those type of like incidental things where the pain that your body's producing it's still a real pain, but it's inappropriate for what the actual stress should be on the body.
Exactly.
And that's the part where we really have to educate people on. Like, springtime is a great example.
Yep.
In the wonderful state of Minnesota, over the winter, it snows, it's cold, nobody's outside.
Nobody's moving.
Nobody's moving.
Nobody's moving.
Everybody's crushing through all their Netflix series. They're hitting all their big movies that they want to binge. And then it's like April 1st, we have our first 70-degree day. Yeah. And people are outside going gangbusters, biking, running, gardening, doing all these things.
House improvement.
Yeah. And because they've been waiting for so long to do it, instead of going out and saying, hey, I'm going to do just a little bit, they spend a whole day doing that thing.
Yeah. I mean, I hear it all the time. I'd say before I was doing a lot of the stuff I do now, but it would be like people would come in, it'd be like, what happens is they're like basically on their last straw, it seems like, and so what I seem like is that like, for example, I heard one time a story where this guy was doing whatever and he was just at work and then essentially he just kind of like fell from somewhere. It wasn't that big of a fall, maybe it was like a foot, not even, and like it just destroyed him. And yeah, maybe that would have been like at that acute time, but I think they mentioned it was like more of like something lingering almost.
Sure.
And I don't know what the injury was specifically, but I could definitely see that as well. Just in terms of, I mean, it's the same thing. It's like you've been kind of sitting inside, you haven't been moving that direction that way. Then all of a sudden, one move, one thing is like you tweaked. You tweaked it, And I, like you said, though, a lot of it sometimes isn't completely preventative. You're at the gym, you're doing a rack pull, for example, and it's like, oh, you just splined your back. You're just doing that. And it's like, what are some like, rehab things that we could do to improve this, and stuff like that.
Yeah, and that's why just a baseline of physical activity is so beneficial.
Exactly.
Not only does it help with general muscle mass, which is a good healthy tissue for us, but it's good for flexibility because it keeps our mobility. Like if you don't like bend to pick something up on a regular basis, when you go to bend to pick something up on an occasional basis, it's just simply going to be harder. And so that's where that physical activity of whatever is so beneficial. It helps from a metabolic standpoint. It does all those things.
Yeah.
So what I try and teach people is if you're planning something ahead where you're going to be physical, gardening, going on a hunting trip is another big one for people.
Yep.
Whenever my hunters come in and say, hey, I have this big 10-day long hunting trip, we're going out in the woods in Montana, one of the first questions that I ask them are like, what are you doing right now that mimics that?
Yeah, exactly.
Are you doing anything close? Are you walking? Are you hiking? Are you doing manual labor in the yard? Do you have a manual job? Like that might be a thing. But either way, if you want to go on this trip and be prepared to do the thing, you have to do things that are close to doing the thing.
Well, exactly.
Or else you're just gambling. And I think that's the preventative side that I try and educate people on.
Yeah.
Like, our body doesn't like to do new things. It likes to do what it's used to, whether that's healthy or unhealthy.
Exactly.
Like from a nutrition standpoint, if somebody's used to eating really, really bad food, when they transition into eating healthy food, they obviously don't feel better right away because their body just has no idea what to do.
I think it's a hormetic response that someone will receive that's more so like initially it's a shock to the system. And I think a lot of it is just regulating, your body is regulating, so it's adapting. Because when we talk about the hormetic response, it's a good thing that causes a negative thing that produces a good thing. And so, like what we're talking about is like you're switching out the junk food for the good food. And at first it's going to be a little bit painful or whatever. And then it's like you're going to feel a lot better. And so it might be the same with that. It's like
just like going to the gym.
Yeah, exactly. Well, I think I want to hone into like I guess like with people that are on my side of things too. Like, let's say someone comes in and they're dealing with a lot of these like lifestyle conditions. I got cardiovascular disease, high blood pressure, blood sugar issues, or I just have a lot of like weight issues. I mean, I'm sure that maybe some people that deal with the problems they dealt with, some maybe a little fraction. Because remember, we're looking at the body in whole, so it's not just one. It's not just like it's the weight issue that's causing the problem. There's a lot more to it. But like, let's say, what are you telling those type of people, they're dealing with those type of lifestyle diseases and problems, I should say, or symptoms?
Sure. So I get a lot of people that will come in, let's just say for an acute episode of low back pain. They gardened too much, irritated their low back. I'll get a number of people that come in and kind of talk me through their situation, and I'm thinking, it's a pretty mechanical thing. They just overworked it, did too much, and they'll, on a regular basis, always slip in the comment, well, I know if I lost a little bit of weight, my pain wouldn't be as bad. And like, people automatically register being overweight with more pain. And it's kind of a tricky topic because part of that is related, but part of that is not.
Exactly. Well, holistically. I mean,
Right.
you know, like I look at it as being like, well, if someone's taking, you know, thyroid medication, it is flooding your body with more T4. Is that going to help the issue? And that would be yes. It could help most definitely. And so, but is that going to be the only thing that's going to help you with more energy?
Right.
You know, so someone comes into their primary care physician and they're feeling like they're dealing with fatigue or whatever. Well, is just adding more thyroid hormone going to help? Yeah, maybe help a little bit. Just like, hey, maybe if I lost some weight, it'd help.
Right.
But it's not going to fix the complete picture.
Right.
You know, exactly what you're saying. Like if I lose a little bit of weight, yeah, sure, it might help a little bit, but it's still not, you know, looking at the body in collection and what completely and fixing the issue at hand.
Right. And that's kind of the part where I try and compartmentalize all these different factors. You know, let's say someone is a little bit overweight. Okay, that's a factor. Let's say somebody is super stressed right now with their job. Okay, that's a factor. Let's say they've been traveling more. That's a factor. Let's say they haven't been as active as they normally are.
Yep.
That's a factor. And what I try and do is I lay them all out and kind of present them and just say, hey, these are the pieces that I think are a part of the puzzle. I don't think it's the right decision to try and change all of these at the same time. Because I don't know, I'm assuming our worlds are different where you can't just tell someone, hey, change these 5 things in your life.
Yeah, exactly.
Right? Like that's not reasonable.
Exactly.
So it becomes a conversation about which one of these do you think is the easiest thing for us to change right now, knowing that it's going to have the trickle effect that affects the whole person.
Well, exactly. Well, I just, you know, was thinking like, you know, you say that, yeah, maybe if I lost a little bit more weight, it would reduce the pain. Well, maybe some of the modality is getting more movement in collection that will help you lose weight, you know?
Yeah.
Or it's like, maybe I'll eat a better diet, so that's going to help me lose weight, while help me have the energy to do more exercise.
Exactly.
You know, and it's a trickle like domino effect where it's exactly like that. So like, I see all the time in my practice, in terms of like, hey, Diego, I mean, like most people come in and they have no desire to work out or whatsoever, to do any movement, get any type of steps in throughout the day. And it's like, yeah, I understand that because you have no energy. Your cells are deprived, you have no nutrition, you're probably dehydrated, you got nutrient deficiencies, you got whatever other issue going on. And it's like, once we start correcting that, you know, and this is really what happens, is that people start having more energy, they have better sleep, they have more just mental clarity, and then from that they're able to then get into the gym or get in movement, which in theory will help them then lose weight since their output's a little bit higher. And so it's the same thing there. It's like, hey, let's just focus on like, okay, this week let's try to slowly get in more of this movement of whatsoever. You know, going back to the example you gave, the person that's going hunting, you know, they have a trip coming up in 60 days, 2 months or whatever. It's like, okay, well, this week let's focus on, until we see you again or whatsoever, it's like, let's focus on, you know, maybe mimicking the amount of steps you will be getting in. Let's try to hit that daily. And then from there, it'd be like, okay, let's try adding some load onto there, because I'm sure they're carrying different types of things that help with hunting. And then you're able to then add that in. It's like a slow progression. And then by the time you get to that event, it's like your body's trained for that. It's not a surprise. Like, it's not a shock to the system. It's like, all right, I've been through this. I've been doing this. It's the same with all sports. I mean, there's practice
100%.
for a reason.
I was just going to say that.
There's practice for a reason, and you replicate the movement. And I know it so well because, you know, I played collegiate football, but I think a big thing I like to think of is like track. Like, I ran track. And so with that also being said, it's like, hey, like initially we're going to try to sometimes run race speed, not 100% the whole practice or whatever, but it's like, hey, we'll at least have a rep or a set where it's like, hey, we're practicing game speed, or even for like football, you know, when you're doing whatever. But yeah, that's incredible. That's crucial.
Yeah, it's one of the ways that I look at it is looking at physical activity and understand that it kind of fits under a like intensity pyramid, where we're going to have this super high intense stuff. So like you said, race speed, if we're running sprints, we can't run sprints every set of every practice, you know, through the whole season. The body can't, can't maintain that. It's risky, and it doesn't allow us to build as well as we could, versus if we have a certain amount of foundational low intensity work, and then a middle range of moderate intensity, and then the peak stuff. And what that really teaches people is how to appropriately have proportions for their activity.
Exactly.
And one of my favorite examples, I was working with this realtor, and he fell in love with pickleball. Just one of the many people in the last 5 years that just head over heels for pickleball.
Yep.
And he came in because his shoulder was hurting and his low back was hurting. And I just asked him, like, okay, talk me through your week. Like, what does a week look like for you in general? Knowing that, like, he's an intense dude. He probably plays some intense pickleball. So I'm thinking, okay, he's at least hitting the tip of that intensity pyramid. That's fantastic. What else is he doing? And what I found out was 6 out of the 7 days of the week, he was in his car, he was at his desk, or he was sitting around at home doing nothing. And then 1 day a week, he would go guns blazing and play 3 to 4 hours of like high intensity pickleball.
Yep.
And I was trying to explain it to him, like, that is just too big of a change for your body to handle comfortably. That's why it's hurting. And it's also making this activity more risky than it really needs to be if you do a little just prep work.
Yeah, exactly.
And he just said, like, well, I either don't have the time or I just don't want to do the other stuff. Like, I just want to play this way. And I told him, I was like, if you're going to tell me that all you want to do is just play this really hard once a week, that's kind of like you talking to a home buyer and you trying to tell them, hey, we need to save up a little bit more money. If we can build up a little bit more money over time, then we're going to be able to make this big purchase.
Yep.
And then that person turning around and saying, nope, I'm only going to save money once a week. Do you think that's going to get me there?
Yeah, exactly. I think it's instilling that reframe in their mind, and to a maybe an analogy that they could understand, because some people, I think, forget that sometimes when you see someone like us, we're doing what we're doing for a reason, and we obviously have the most best interest in our hearts to be able to help you, and so our recommendations is not anywhere to detriment how things you want to do, but it's, matter of fact, the opposite, to improve everything you want to do.
Yeah, I want people to get more out of life with the things that they want to do.
Exactly.
Period.
Exactly.
I don't care if your activity is knitting.
Exactly.
Like, it doesn't matter to me at all. I get excited for things that other people get excited about. And all we're trying to do is like support that and remove obstacles.
Yeah, absolutely. Well, I guess I wanted to hone into, like, so what are some of the things that you initially do when someone comes upon your clinic? Are you doing like an assessment? Obviously, there might be a chief complaint. I don't know how you would say that. But so, like, what are you typically doing when someone comes in? Are you doing like movement assessments? Because kind of like I would say the same thing, such as in terms of like, hey, maybe someone comes in and they're dealing with these specific problems, and then maybe I'll do a lab, for example. Sure. More of like, that's a whole different topic, like a functional lab, but what are you typically doing?
Sure. So the first big part is I'm talking to them, probably for longer than they think.
Yep.
But what we find, at least in this world of healthcare, is there's a lot of key points just in the information that you'll get from a person.
Yep.
In terms of what's relevant to their history or not. So we spend probably the first 10-ish minutes or so simply just sitting and talking. I'm asking them questions, they're asking me questions, and we're trying to get all of the good information out on the table.
Yep.
From that point, then we usually go into the assessment, which, when we're dealing with most either pain conditions or joint movement dysfunction things, then we'll take them through some type of movement assessment. So kind of what you were alluding to.
Yep.
So at the beginning of my career, I went through this training certificate called FMS, or Functional Movement Screens.
Yep, exactly.
And so what that group did is they kind of took the major parts of the body, clumped them together, and put different tests. Basically saying, if we take somebody through these tests in the neck area, then that's going to give us a pretty good idea of what's going on. Joint problem, muscle problem, disc. Maybe it's just simply a nerve pain type of thing.
Yeah.
But it's all movement related because the movement is really what teaches us.
Yep.
Yeah. I don't do as much specific FMS stuff anymore just because you can't always categorize people.
Yep,
You
exactly.
can't kind of put them into a box. But I take the same principles to how I move and assess people.
Okay.
And then during that assessment, there's also a lot more communication going on as well. Because I remind everybody, I don't feel what you feel.
Yeah, exactly.
Period.
Exactly.
And so I need your information, your help to paint the picture in my head of what I think is going on. And so through the assessment, that kind of really helps us hone in on, okay, this is where we think maybe some of the main pain generators are. This is why we think they're mad. And then that kind of leads us into the treatment of, well, this is what we're going to do about it.
Yep.
And the treatment has a couple different parts to it, but one is, like, we're a hands-on chiropractic clinic. So I do a lot of adjusting hands-on. I do a lot of manual therapy hands-on. We'll also do other rehab stuff from a movement standpoint. But then what we also talk about are what are the other solutions outside of the clinic that the person can do that's going to help continue to push this progress.
Yes.
Because I get to see people for a tiny fraction of their week.
Exactly.
And there's only so much influence that we can create in this time versus if we can add value or improve their skills across the other time that they have without us.
Yes.
That's where the magic happens.
Yeah, I mean, yeah, true transformation does happen. I mean, it's basically instilling those lifestyle changes for that individual to make to, you know, help with whatever they're dealing with.
And what's interesting in our world is it's really, really motivating if you're working with somebody that's struggling with pain, if you can even make them feel a little bit better for a little bit of time.
Yes.
Because so many people just endure this pain that they maybe don't think can change. They think it's only going to get worse, and they're kind of confused about it.
Yeah.
And what's cool about some of the treatment stuff that we do is some of it can be really helpful at creating short-term pain, and that's what removes that initial barrier so that they can go out and do the other stuff.
I mean, I can allude to that so heavily because, I mean, people come to me every day and they're like, I'm struggling with this issue. Like, I don't even see a light at the end of the tunnel.
Totally.
And then at first, I think the biggest thing that I see is that it's hard to make the changes needed or doing the things needed to be done. But after that hurdle, you feel so much better. It's so reinforcing. You know, because I get clients all the time where they're like, Diego, I'm never doing the things I used to do, you know, and a lot of it's just lifestyle. Like, I'm not going back to that eating style. I'm not going to go back to so much alcohol. I'm not going to go back to not moving my body enough throughout the day. I'm not doing that because I don't feel good. I don't, you know, I don't love that. I don't want to do that. And it's the same there that you're speaking of. So I guess like a big thing too is that like if someone was interested into, you know, checking out your clinic or whatsoever, like what are some key things that you think their benefit would be if they came in and saw you?
Sure. So I think the first thing is just helping people get some type of clarity about what's going on, because pain can be confusing, health can be confusing. And so working with someone that at least can see the interconnectedness of things and hopefully try and communicate it in a way that makes sense is going to be helpful, you know, not just in this room, but outside of it.
Exactly.
And so I get a lot of people that come in, even if it is for just a general pain thing, but we do our assessment, we educate them, and we really help them understand just what's going on.
100%.
And when you can help somebody understand what's going on, they make way better decisions about it. And so I think that's the first part is we remove a lot of fear for people, and we just give them a clear picture of what's going on and a good direction to go. Like, I'm all about just making sure people are going in a good direction.
Exactly.
Yeah.
And just instilling, I guess, the habits too, like you mentioned, to be as preventative as you can with the pain that you initially came in for.
Right.
You know, because I think we can all attest to, like, clients probably come and see you, patients come and see you, and they've been not dealing with this issue, most of them maybe for a few years now.
Sure.
It's been an ongoing problem. So it's like, not only will I help you actually kind of correct the issue, but make sure that you don't deal with it again. I think it's like a huge thing for you.
Yeah. Well, and another part too, for the people that have been dealing with stuff for a long time, a lot of people just cement in this idea that, okay, well, this is just how my shoulder is going to feel like either until I die or until I have surgery.
Yeah, exactly.
Like they basically just like accept that this is what it's going to be like. And for some people, maybe that's the case.
Yeah.
But not for most. And what amazes me is when we can again shift somebody's direction for what they're doing, and treatment's probably a part of it, but I've had people say like, hey, this is the best my low back has felt in 15 years.
Wow.
Or like, hey, I haven't been able to do this with my shoulder in like 8 years.
Wow.
And it's not like we're doing anything magical here. Like my adjustments aren't magic.
Yeah.
My manual therapy, not magic. I think it's good, but it's not magic. The magic is painting that really good picture for people to understand what's going on and letting that help them change the things that they need to do to just get their body to change.
Yeah.
And so it's just so fascinating that the body can change like that once you give it the right things.
Yeah, I mean, as someone who firsthand has been doing that too, I can attest as well, like people thinking that they're going to need to be on a specific medication or really just feel the way that they've been feeling. They don't see any end of the tunnel, like light at the end of the tunnel. And it's like, yeah, what I'm doing is not magic. It's incredible, but it's all like things that you do yourself. You're able to do yourself. You have the empowerment to self-correct yourself, so to say, without needing to use those external things. Yes, those are great tools and really helpful and needed at times, 100%. But you have everything already inside you to make the transformation that you want, to feel the way you want, and most importantly, really move the way you want.
Yep.
So I guess, like, Luke, if they're located in the Mankato area, where can they find you? And website, kind of your social media as well, if people want to follow along, whatsoever.
Yeah, so the clinic is called Kinetic Spine Sport. We're located right next to the Mankato Moondogs office.
Okay.
So the local summer baseball team, so that's kind of a landmark that people know.
Yes.
You can go to our website, kinetic-chiro.com. We have an online scheduler, so you can take care of all of your scheduling things on there. We also have just a bunch of other information on there. You can call or text our clinic. So sometimes people will hear about us and they'll have a question. So they're able to just text our clinic number.
Okay.
We'll probably just put that in the post
Yep,
somewhere.
we will.
But that just gets the message into our communication system. And I've just sent questions and answers out to people that I've never met before. And in hopes that at least helps them make a better decision.
Exactly.
So we have that. We have an Instagram page. We also have our own podcast on Spotify. So it's just Kinetic Spine Sport Podcast, that we're kind of working through some episodes on there. So there's a lot of different ways that people can communicate, just whatever works.
All right. Well, you guys got it. Dr. Luke Weber here at Kinetic Spine. If you guys are interested, please reach out. I'll leave more information down below and hoping to catch you soon.